Thank you, Bill. You exemplify that beyond Rotary service are Rotarians doing service, and that's really a strong part of our organization. I'm going to steal some of Tracy's thunder on an introduction, if she doesn't mind. I'm just going to pull executive privilege. I would like to introduce Megan Gerhardt, first of all. Megan is a global grant scholar, and I'd like to also have her parents, Melanie and Kevin, stand to be recognized. Megan plans to pursue a Erasmus Mundus Joint Master of Global Development Policy from 3 universities in Europe. Megan's hometown is Roanoke, Indiana. She graduated from IU this past May with majors in international studies and recreational tourism, hospitality management, okay, and was selected over 3 other finalists for Rotary District 658O's scholarship. She is a rock star, and it's just an honor to have her here. So with that, Tracy, would you like to introduce the rest of our guests?
First, let me say the energy in this room is phenomenal today. I don't know what it is. Maybe it's the kids being back. It's the kids. It's the young students being back on campus or what, but I can really feel the energy. That's awesome. We have quite the contingency here from Ivy Tech. So as I speak your name, please stand. Heidi Schultz, Director of Development, and Kimberly Roach, Dean of Nursing, Carly Wyatt, Dean of Health Sciences, and I think you all are sisters, is that right? That's awesome. And Eric Coyne, our new Chancellor, all guests of Sam Udak. Then we have Hannah Hirsch's guest, Alec Blake. Alec. And Betty Coffey, Glenda Murray's guest, retired clergy. And let me just check. I believe that's it.
We'll hear more about Ivy Tech in a few minutes. We have some birthdays to celebrate. Rumor has it, Jean Hurley will have a birthday on August 25th. Chris Knoll will have a birthday on August 23rd. And Bill Oates will have a birthday on August 24th. Congratulations to all 3 of you. And we have some membership anniversaries. Susie Graham, 9 years. Len Tiemann, 1 year with our club. I see Len is not here, but he's in Reno right now, but 4 years total. Online guests, Michael, are there any online guests?
Not today. Zoom,
Okay.
just all of us here in Zoom.
All right, thank you. Now it's a pleasure to ask Sarah Laughlin and Alon Barker, I'm sorry, to come up, and we have an installation of an institutional membership. And I'd ask the members from Ivy Tech that are here to come up and join us on stage. Oh, I'm sorry. Rich. Yeah. Ivy Tech next week.
Where do you want me to stand?
Come on over here, Richard.
Okay, would you like me to go ahead and do the intro? This is my sponsor.
Yes. Okay, so am I, okay, I'm up. Hi, everybody. I am here to introduce Richard Milinchuk. He's currently a startup coach at the Mill, otherwise known as the Dimension Mill, amazing place, and a consultant to CEOs at the early stage SaaS-based companies. Is it SaaS or SaaS? SaaS, okay. Softwares and service, there we go. This is in addition to being an angel investor. He's very active in the Bloomington entrepreneurial ecosystem. Richard moved to Bloomington with his wife, Joanna, after 25 years in Ann Arbor, Michigan. They are the parents of proud parents of 2 adult children, Benjamin, 23, who lives in Denver, Ava, 20, who lives in Ann Arbor. He has a BS in marketing from DePaul University in Chicago, and he enjoys traveling, live theater, and anything his kids are into. Professionally, Richard has over 25 years of startup sales and operations experience. His professional experience spans various industries, including PC-based control, telecommunications, security software, and the last 15 years have focused on retail ad and marketing technology. His volunteer experience has included everything from being on his congregation's board to patent stakeholder for Michigan Medicine, a student advisor at the University of Michigan Center for Entrepreneurship, yay, an advisory board member for the Startup Ladies of Indianapolis and the Kelly School, and it goes on and on and on. In short, he thrives on helping others believe in themselves and achieve their dreams.
So Richard, on behalf of the board and the membership of the Bloomington Rotary Club, it's a great pleasure to welcome you as the newest member of our club. We look forward to the fellowship that we will share, as well as your participation in the club projects that make our club, community, country, and world a better place. Though Rotary is not a political organization, Rotarians are vitally concerned with good citizenship and the election of effective leaders to office. While Rotary is not a religious organization, it is built on the highest principles that have served as a moral compass for people throughout the ages. Rotary is an organization of business, professional, and community leaders pledged to uphold the highest ethical and moral standards. Rotarians believe that worldwide fellowship and peace can be achieved when people work together and uphold the Rotary model, service above self. Rotary activities exemplify the partnership, respect, and generosity that one would expect from people who believe they have a responsibility to help others. Richard, you have been chosen for membership in the Bloomington Club because your fellow members believe you to be a leader in our community and because you possess the qualities to champion the message and principles of Rotary. You're a representative of your vocation and talents within our club and community. You have now become an ambassador for Bloomington Rotary, carrying the ideals of service to all within your sphere of influence. Our community will know and judge Rotary by your character and service. We will also look to you for inspiration as we strive to become better Rotarians. We now pin you, somebody will, Tracy will, with a distinguished badge of a Rotarian, your Rotary pin. We ask that you wear your Rotary pin with pride in your many endeavors and as a symbol of our recognition of your contribution toward a better world through your Rotary membership. Fellow Rotarians, please rise if you're able and welcome our newest Rotarian, Richard Milenchuk.
Congratulations and welcome to our club. Usually a citation is not a positive kind of thing when you get one, but we have a Rotary citation and it kind of exemplifies Alon's leadership of last year. And I'd ask Tyler to put it up so you can see the citation that we received from Rotary. That again means great job, Alon, for the work you did as president, and congratulations. Liz Feidel will introduce our program today. I think you're going to enjoy this program.
Good afternoon. As soon as technology works here, I'll be right with you. Hold on. Oh, here it is. Oh, for heaven's sakes, I had it. Oh, this is embarrassing. Well, shall I wing it or what should I do here? All right, so you'll get my real wing here. I had it all printed out and everything, but it's basically what was in the Rotary roundabout about Shawna Girgis. I got the right pronunciation of her name. She's been at IU Health now since 2014. Oh, 3 years, I'm sorry, but she was mayor before in Bedford, and she brings a wealth of experience and community love for community to this area. To have her be a part of our program today is just truly inspiring, and I'm sure she'll give us lots of information about what it is that's happening at IU Health. And I look forward to hearing what she has to say as you do. And I hope you give a warm Rotary welcome to Shawna Girgis.
Well, good afternoon. It is great to be with all of you today. Thank you for the invitation to join you. I should say a warm welcome from Brian Shawna. As you may know, he was intended to be here. He took on a new role at the state system level. So they asked me if I could come and I said, absolutely yes. So it's really my pleasure to be with you today. So obviously I'm here representing IU Health, and I'll just add a couple of things to what Liz said. So one of the great things about my role is I still live in Bedford, Indiana, so I'm a very proud Bedford resident, but I get to work throughout the entire region. So that includes obviously Bloomington and Monroe County and like 10 counties. That obviously includes Bedford as well. So Liz, probably the reason you thought I've been with them for so long is because my husband is a physician with IU Health in Bedford. He's an internal medicine physician. He does inpatient and outpatient medicine. So I joked when I joined the IU Health team officially that I made it official, but I've been married to IU Health for a very long time. So yeah, so I'm very proud of this organization and the work that we are doing. Actually doing great work. I know you know a lot about the things happening here at IU Health. So we'll just go to the next slide. So today we're going to talk a little bit about kind of our South Central region overview, some of the great things happening at the new hospital. I'm sure you're interested about primary care access, as well as some of the great things happening on the public health front in the state of Indiana. And then we're going to talk a little bit about some of the work that IU Health is doing as far as community health. And really, that's how we feel about making sure people stay healthy. Like, right, we would love for everyone to avoid being in the hospital if at all possible. So our community health team is very broad and doing a lot of great work in that area. So I need to tell you a little, I have the clicker and I forgot. Sorry, I apologize. You stole it from me. Okay, sorry about that. So just a little bit about IU Health as far as our mission and vision. Really the vision of IU Health is to make Indiana a healthier state. And really we do that one individual, one patient at a time. And we focus in on what we call, it's top of mind for all of our team members. What is the best care designed for each individual patient? What is the most important thing to them that day? And how can we help them meet that? We have the purpose to do good in the lives of others. Excellence, we do our best at all times. Compassion, we treat all people with respect. Kindness and empathy, and then our team that we count on and we care for each other. And I really am very privileged to be a part of this team. It's a great group of individuals. So a little bit about the South Central region. Obviously, I mentioned the 11 county focus area. We serve about 470,000 residents in this region, which I find it's kind of hard to believe that there's that many individuals. We obviously have multiple hospitals in this region as well. We have 435 providers that are part of IU Health and SIP, which Southern Indiana Physicians. And so we also have added in the last few years 8 urgent care centers and walk-in clinics. And so I'm going to talk to you a little bit about the team members that we've added over the last few years and talk about access. But it is a broad region. We're serving a lot of rural communities as well. When you think about the economic impact, it is significant. And yeah, so, and what fun fact, you may not know this, but about 51% of our admissions actually originate outside of Monroe County. So you are serving a very large rural area in this region as well, which obviously is a passion of mine, given my background. Okay, as far as economic impact, I'm not going to read all of these to you, but I think the takeaway is with over $575 million impacted in this region from IU Health in 2022, the impact is great. We have about 5,000 team members throughout the region, and about more than half of those are from outside of the region as well. So again, it's a large system trying to serve the needs of communities throughout this entire region. So it's a big organization. We're having a lot of impact, but Bloomington is our hub. Obviously, with the new hospital, I'll talk about that in a second as well. It's our largest facility. We have the most number of team members coming to Bloomington every single day. So as you know, we opened the new facility on December the 5th, 2021. I was outside those doors on that first day, and I think several of you were there with me in the cold, welcoming our team members into the building for the very first time. The building has 620,000 square feet. It is, Bill, you'll be happy to know, very energy efficient, LEED certified. It also has, with that, is projected cost savings as well as what's good for the environment. We have state-of-the-art technology in that building. I wish I could take all of you what is behind the scenes when that building was designed, in the legacy facility, as in, I'll say in the other hospitals, things were happening and patient facing that now happen completely behind the scenes. So equipment gets moved and it's not in the main hallways where you're walking. Patients are transported. We can better protect their privacy and things of that nature as well. It's just an amazing facility with all the technology and the things that are happening behind the scenes. Again, I mentioned the efficient operations. It is acuity adaptable, which what is so great about this, and Liz and I were just chatting, and Leslie, but about acuity adaptable is, but initially when you come in the hospital before, you may come in, if you came in critical condition, and as you progressed and improved, you might move in a different area of the hospital several times. Now in the new facility, because all of the rooms are constructed the same, the team members adjust to you and you can stay in the same space, which is better not only for the patient, but also for their family. So acuity adaptable is a guiding principle in this new facility to improve those experiences of patients and their families. We have what I believe is unparalleled clinical care, training, and research in the facility because of our new partnership with Indiana University. So the new facility is, we call it the RAC, but in public, it's the Regional Academic Health Center. It just takes our partnership with IU to a whole new level. And we have interprofessional care teams. And again, all of these things are designed to have enhanced experiences and care for all of our patients. All right, I have a video for you today, so we're going to show this. This is actually Move Day. Some of you may have already seen this, but every time I watch it, I am kind of in awe. I did not arrive at 3 in the morning. I think I arrived at 4:30, but so much was already happening that day, and it really was remarkable, particularly if you can just recall that we were having a COVID surge at the time and all the logistics that were required. So let's take a look at this, and then I'll talk to you a little bit more about the facility.
The heart and the soul does not lie in the brick and the mortar, it lies within the human heart. Space carries meaning and it carries memory. But the important piece that we want to acknowledge is that the people that make the healing work is going to continue now and in generations to come. Cover our patients with safety, strength, and wellness as they move. Grant skill, resolve, and compassion to our team as they tend to these lives with tenderness and love. To open up this new sanctuary of healing for our community and for our region. All right, friends, well, let's do this. There we go. Yeah.
Based upon all of these greens in front of me, plan in place, the sequence that we're following, and the resources that we have prepared, I recommend that we commence the official patient transfer from the legacy facility.
The message says the IU Health Bloomington patient move has begun.
Yeah, all right.
One down.
Thanks, guys. Thank you.
At the old hospital or waiting room.
Clear, Victor. Okay, Stephanie.
Now, one of the
The alert media message that will go out is short and sweet. The IU Health Bloomington patient move is complete.
It's just a little snippet of all the things that were happening on that day. And so proud of all of our teams for making that successful. I'll go ahead and start talking. But when we think about the healthcare professional training that's happening in the regional academic health center, it is really quite remarkable. We are going to have the opportunity to expand our training to residency programs in both emergency medicine and internal medicine. In addition, as you probably do know, the health sciences building is contiguous with the hospital. And there, the IU School of Medicine, nursing, speech, language and hearing sciences, and social work are all located in that building. It really creates remarkable opportunities for training for students to just literally walk across the hall and be with patients, with practicing professionals, and really get state-of-the-art experiences. So we are very much looking forward to this expanding as the emergency medicine residency is slated to start in 2025, and internal medicine is slated to start in June 2026. So this is a remarkable opportunity for many reasons. So when you think about the why is this important? It obviously supports the vision that IU Health has for making healthier individuals and communities. In addition, it really does strengthen the connections between the university and the hospital. And we know that when residency programs are located in a community, those surrounding communities are much more likely and have a greater return as far as physicians and advanced practice providers staying in that area. So that is all great news for all of us in the South Central region. So probably one of the questions that you have on your mind, I suspect, is about primary care access. This is a question that many people have. This is just a snapshot from the Herald Times talking about the changes that are happening at IU Health as far as access. So, you know, COVID was a very challenging time. Several people, not just in healthcare, but in all industries that maybe were on the bubble, like, you know, within a year or two of retiring, decided that they would go ahead and step away from the workforce. That is the same challenge that we faced as well. But what I can tell you, then the last year, we have had a great deal of success in recruiting additional providers and also expanding our urgent care and walk-in clinics. So 8 primary care providers actually left the Bloomington market in that 21-22 time, but all vacancies have been filled. And as of May, we have hired 7 net new primary care providers that will start in 2023. Some of those have already joined us, and some are coming later this year. We really do embrace the care team model. So that's your physician, your advanced practice provider, as well as immediate care access that's needed, oftentimes just-in-time care that helps people avoid spending time in the ER unnecessarily, as well as control their cost, as well as our pharmacist team that provide immediate answers and testing and wellness, providing those to our people as well. 8 immediate access providers are available here in Bloomington alone, and they provide over 550 visits that in each week. So those are same day or next day appointments. One of the things that is very convenient, or is designed to be convenient for patients is that we have a call center. So if you call and you cannot see your primary care provider, those team members are trained on how to help you access those immediate care slots openings as well. So those are just added options for individuals. So it's considered a bridge, right, until you are able to see your primary care provider. We also have urgent care clinics in Bedford, in Martinsville at our Morgan site, as well as Paoli. So again, walk-in hours are available, again, helping individuals make that bridge so they have established that they don't already have a primary care provider, and to avoid spending time in the emergency room. Okay, so let's talk a little bit about public health. So let's be honest, this slide is not overly encouraging. And let's just wrap it up to say that Indiana is not one of the healthiest states in the country. We have a lot of work to do in this area, but it's very exciting when we think about the challenges that we face, when we think about smoking and obesity, chronic illness, and those kind of things, what the case is for our Indiana's public health funding. So as many of you may already know, the governor established his Public Health Commission in 2021. They examined Indiana's public health system comprehensively and made recommended improvements. As a result of that, these recommendations were made that invested tremendous amount more money into the public health system. And so they are slated to start in FY 2024 and 2025. What we know is that counties have the option to opt in, and the next slide will show you that Monroe County has opted in, and as a result, to be able to gain a much more additional funding. There are requirements for each county. I think Monroe County is probably doing most of these, but allows them to have additional funding to expand those efforts. We also know, though, as many of our communities that we serve are rural in nature, much smaller health departments with much smaller budgets. So this additional funding, if they opt in, will help them to really reach the goals, and those people that are often hardest to reach have the most maybe limitations and challenges. So this is very exciting for our communities, and we're looking forward to seeing this go into place. When we think about this as the IU health system, we're very supportive of this effort, because really as a system and as a state, we really can no longer tolerate being about the 45th state when it comes to public health rankings. We need to see a tremendous amount of improvement so that life expectancy increases, so that infant mortality is reduced, and we're able to reach our communities in the way they need us most to prevent having chronic disease, and if they have it, to help them manage it appropriately for their health and their well-being. So when we think about the community health, I want to just touch a little bit about some of the great things happening with IU Health and our community health department. When we think about our priorities, and I put them here, each of them address social determinants of health. And so we are talking about those kind of foundational things that maybe you and I take for granted, that other individuals are lacking. But our top community health priorities are infant and maternal health, hypertension prevention and management, I'll add that, behavioral health and substance use disorder, tobacco and nicotine cessation, as well as addressing the needs of the aging population. So as we think about these, I'm just gonna highlight a few of the programs that we have. We have our nurse family partnership that pairs a nurse with a family that meets requirements from the time a child is born until their second birthday. And this really, there's a strict list of criteria, but helps those who are most vulnerable, who need our support the most during this very important time of their child's development. One of our team members, this is a quote from her, "Being an NFP nurse allows me to live out my nursing values in the fullest sense, to care for the whole person. My clients share their world with me for a short while, but the seeds we plant together blossom over a lifetime." And that is very special work. Our We Care program is a system level program that addresses the maternal health needs of those who do not qualify for the Nurse Family Partnership Program. We also have our fetal infant mortality review team. And as sad as this is, they review fetal and infant deaths and basically make recommendations and help the individual and the community, as well as working with the legal system in those cases as well. We also partner with our WIC program. We do car seats and safe sleep programs. As far as hypertension, we do several public health clinics. People can be screened. We also participate in the Monroe County Public Health Clinic and doing outreach in community places like barbershops, at cultural events, and housing communities, as well as shelters and senior living. We also have programs like Family Vitality and Moms Heal Together in order to help people with mental health and substance abuse disorder. Coordinated school health programs. We have that program here in Monroe County, as well as several other communities that includes outreach about mental health and wellness in the schools. And we also have integrated social workers with both Nurse Family Partnership and our OB offices to support those moms that are just needing extra support. We have nicotine cessation and to beat tobacco classes. And then for our aging population, we have dementia-friendly education and training, as well as caregiver support. We have a class called Stepping On, that is fall prevention classes and basic physical exercise and training for people can be secure and as stable. Meals on Wheels partnership that's lasted for over 50 years with the Bloomington Hospital and them, as well as helping people get enrolled in the state health insurance program. So lots happening. That was really fast, but lots happening in the IU health community, not only for people that are sick and needing to be hospitalized, but also to help people be well and live the best life they can in their home and in their place. And that is, I'm happy to take questions. Yes. Oh, okay. We're gonna get your microphone.
So I know in the past year or so, many Hoosiers have been de-enrolled from Medicare and Medicaid. What do you, from an internal perspective, what role do you think that IU Health has in making sure that people can still get affordable health care?
Yeah, so one of the things that we can do, I mentioned the community health program as far as getting them enrolled in the state health insurance program. We do have teams of people, of individuals, if they're struggling with their health finances, to help them work through that. We also can make referrals outside for those that are struggling or may be eligible. So we're here to help them with that. Hopefully that answers your question. Yeah.
I just want to share a comment. This is really good information. I moved to this place last September, and I am yet to see a doctor. I still fly to North Carolina to see my doctor. I have thyroid issues, so I just had to fly there, get blood work so I can get my medication. This is really helpful because I almost went back because I couldn't get a doctor.
Yeah. Well, thank you for sharing that story. I'm sorry about your struggle. You know, one of the things too, I recommend, so I told my own story. Since I'm from Bedford, I saw an OBGYN from the Dunn Hospital I established there many years ago, and they're not there anymore. So when I needed to establish, I had a recommendation of who to see. She had a very long waiting list. We have added several new providers in our OBGYN office. So I saw somebody that I didn't know. He's brand new, but they did get me in within like 2 weeks. So, you know, if you're struggling with that, you're free to contact me. I can help you maybe find a team member to help connect you, but definitely want to make sure that you establish your healthcare here in the community so you're not having to travel far. And we have great providers who really want to see you.
So I'm going to pull executive mic privilege since the precedent's been set. And to kind of tag on to what Shawna just said, we moved here 4.5 years ago, so it was pre-COVID, and I've lived in 16 states, 4 of them twice. And this is the most difficult place ever to find a doctor. And so my question, and then I look in the neighborhood and we've had doctors move in and out like a revolving door. What is being done from a survey standpoint to solicit feedback, and what actions are being taken to stop the revolving door?
Yeah, that's a great question. So one thing I can tell you of being both a team member and the spouse of a physician that is in the system is IU Health does a lot of work around getting feedback from our team members. So, and I would say it felt to me like it even increased during the time, like post-COVID. Or we thought we were post and then it was back, I should say that, or I felt like that in my life. So we are getting feedback from team members, and I can tell you that their needs are, and their concerns are being addressed. Is it a magic wand? No, but a lot of effort is being done in that regard. I can also say, again, this is me kind of experience it through my spouse, right? A lot of work is being done too to help, maybe I'm gonna use the word reestablish the connectivity among providers. I do feel like, again, I'm just speaking from what I saw going on at my house even. During COVID, it was such an overwhelming time. Everybody was hands on deck. I think it was all heads down, just trying to get the day's work done. And so there is more effort now to actively connect among themselves. I think community makes everybody's work experience better. And when you feel more invested and, you know, grounded in your work family, I think it makes a big difference. So,
Do we have any questions online? Jeff Richardson?
Yeah, thank you very much for your presentation. I'm actually homesick, so that's why I'm calling in. I've been very pleased with my the healthcare I've gotten, but it's as Tracy said, it's sometimes difficult to get an appointment. I think everyone in the room acknowledges that, unless they have an unusual situation. I guess it's a two-part question. One is sometimes when people are upset with their healthcare, they, not surprisingly, blame IU. It's all about IU and IU dropping the ball. And you know, some people are IU grads and they love the university, and it's all put on them. And could you explain what IU's role is within IU Health, just to clarify that, quote, IU, that Pam Whitten is not running the show? And the second part of the question is the impact of some of the decisions that are being made in the state legislature that might tie your hands in trying to recruit the best people you wish to have working at IU Health. So those are the two parts.
sure. Well, let me tackle, I think I'm going to tackle the challenge of the way you get an appointment. I think, so you know, when you call in to your primary care office, you get a team of people that are what we call our call center. So I think the first thing I would encourage everybody in this room to do, and then to share with your friends and family, is they are equipped not only to help you get into the office that you're calling about. So if you can't see your primary care provider today, or if you don't have a primary care provider, they are equipped to assist you and make an appointment with one of our urgent care team members, which is same day or next day. So I'm just encouraging you, if they don't offer, hopefully they are. If not, and you can't get what your top desire is, the person you want to see, they should be able to help you to do that, and then create that bridge and help you also schedule an appointment with your primary care provider that may be weeks away. So let me just encourage everyone, whether you're online or in the room, to do that and share that information. As far as the IU, Indiana University and the IU Health Connection, we are definitely partners. We work together. But when I think about it, and I know there are others, but the main connection that we have now, in addition to like community collaborations that probably many of the organizations represented in this room have, is that we are helping and working together to train healthcare professionals of the future. So by being co-located with, literally our buildings connect, we are going to be able to support, well, first of all, many of the programs are growing and expanding. So we are able to provide that clinical training space. And I should say, as I'm looking at my Ivy Tech friends, I should put in my bio also, I've been on their board for a long time at Ivy Tech. They're doing an amazing job training healthcare professionals and nurses. So we are also working with their students to do clinical training, but we are the primary place for students to do their clinical training. We want them to have state-of-the-art clinical training experiences and connect not only in Bloomington, but this entire region, with the goal of, one, turning out the best trained people in the country, but also to keep them here in Bloomington in this region to serve and care for our people. So that is our primary connection. Pam Witten is not over IU Health. Dennis Murphy is. I do know she serves on his board, and so they collaborate, and they're colleagues and they work together. But that's how that works. So what's happening at the hospital, you cannot call President Winton's office and get an appointment. You have to call us. So and we're here to help you. So I'm sure it's kind of funny how that works sometimes with people. I used to get calls at City Hall asking to get appointments in my husband's office, and I'd have to explain that's not how that works. So anyway, so I understand that. As far as legislative, there has been a lot of things happening in the Indiana State Legislature that is creating some challenges for healthcare. They are many. I will be honest, I didn't come prepared with all my talking points about that. But we continue to monitor that very closely. And we are advocating with our local elected officials in the State House to share with them what those are. I know that their intentions, I know those individuals, their intention is to make your experience better. And so I do appreciate that. But we continue to work through what are the ramifications. I believe that with all legislation, there is almost always unintended consequences. So we keep that dialogue open and sharing those with them with the hopes of always. I teach a policy class here. Policy is a very cyclical thing. It happens. We make new legislation, we see what's the good, what's the challenges, how can we improve it, and then we modify. And so that's at least that's my vantage point as far as the policy, but we will continue to do that.
Yes. So I have a question about the facility itself. It is state of the art. I've been there quite a bit with my husband over the past year or so, and I was struck by the fact that I couldn't find a stairwell. I saw lots of the elevators were very prominent and you could find an elevator, but I thought, well, in this healthcare facility, it might be nice to have a stairwell.
Yep. That's an interesting question. Now I know where they are because before it was finished, I took the steps up and down all the floors. So I've never really thought about it from a vantage point of someone who's never been in the building. They are there. And I never thought about it not being obvious. So I need to probably walk through the building again and think about that and share that with our facilities team and see what we can do. But I never really considered it. Obviously, we have emergency exits marked. But yeah, that's an interesting observation. I will take that back to our team. Thanks, Liz. Yeah, Steve?
I noticed in your last graphic at the bottom of the list was a line on aging population.
Mm-hmm.
How does, as I'm a proud member of that group,
we're all headed there.
How does one access that information and find out what is available?
Sure. So let me tell you, I probably just skipped over it. We have programs in regards to dementia-friendly education and training. One of our teams has a federal grant to actually help with that implementation, doing education around that. Also support groups for individuals and family members that are struggling with dementia and some of the ramifications that is a part of that as well. And I think the best way to connect those is through our community health team. And I'm happy to share that information with Liz and the club here so they can share that with you so you can connect with them directly as well. Okay. You're welcome.
Thanks, Shawna. In honor of your presentation to us today, we will be making a contribution to Stone Belt. And we really appreciate you being here today. Finding a doctor is not unique to Bloomington, Monroe County, or anywhere else. My son is a physician in Salt Lake City, and he's booked out through November at this point. So, it's happening all over the country. And it's something that I think politically and through our legislature, we have to deal with. It takes a lot of people to pull off this meeting. I want to give thanks to Jim Shea, who was our greeter today. Tracy did double duties, Tracy Jefanovic, both introducing our guests and also camera and mic operator, and she could get through this room without bumping herself around as she did before. And Michael, thank you, Michael Shermas, for being our Zoom host today. And Sarah Laughlin, our reporter. And again, Tyler, for the excellent job that you always do. Our next meeting will be back in the Frangipani room, and it'll be Ron Walker, who is the CEO of CFC. Now, if you will stand and join me in the four-way test of the things we think, say, or do. The four-way test of the things we think, say, or do. First, is it the truth? Second, will it follow the concern? Third, will it build goodwill and better friendships? Fifth, will be beneficial to all concerned. And fifth, is it fun?